Ashley Hill. I am the medical director of the Advent Health Obstetrics and Gynecology team here in Central Florida. My partners and I have fielded a lot of questions lately about how pregnant ladies can protect themselves and their babies against COVID-19, the coronavirus. So let's talk about that for a minute. What we know so far is that thankfully, pregnant ladies do not seem to be at any greater risk than anyone else who is not pregnant of having bad outcomes from this virus. That's good news. We also don't think that the virus can transmit itself vertically, which means from the mother to the baby. Also good news. Now, as things unfold, there'll be more medical information coming out, so I would always suggest tracking what the Center for Disease Control says, and we're going to talk a little bit more about that in a minute. So what can you do to protect yourself and your baby? Well, the same things that we advise everybody to do out in the community. Socially isolate, which is difficult to do, but stay at home, stay away from other folks. If you have to go out, then stay 6 feet away and follow the current CDC guidelines on what to do. You should also wash your hands a lot. I wash my hands a million times a day, all right? Nothing bad ever came from washing your hands. So wash your hands with soap and water for at least 20 seconds. The other thing is to use the alcohol-based sanitizers, which are perfectly safe for pregnant ladies to use. No harm to the mom or the baby from using these. What happens if you have to work? Well, first of all, thank you. There are a lot of folks, as I go back and forth to my office in the hospital every day, that I see who are out in the community working to support our country. They're doing critical things, keeping our groceries up to date, participating in the healthcare services. I was walking through the hospital yesterday in between delivering babies, saw people working in the cafeteria, people transporting patients, working for the blood bank. Thank you, thank you, thank you for doing all that. Had a patient of mine come in a couple days ago who's a teacher, and as she left and told me about what her day is like trying to teach kids online, I thought to myself, I would rather have 15 women in labor at the same time than try to corral a bunch of grade school kids online to teach them online education. So thank you and bless you. So let's talk a little bit about some resources that you can use to help yourself. Actually, before we get to that, let's talk about how to navigate the healthcare system. So things are changing, and probably there will be some good permanent changes from these. One of those, in my opinion, will be telemedicine. So your practice might be participating in telemedicine, which it technically means a telephone call or a FaceTime or a video to render your healthcare remotely with your healthcare provider. Seems to be working out great. So the doctors and midwives and nurse practitioners love it. Patients seem to love it. So if your practice participates in that, that's great. Set up the appointment. Use that as a resource to keep yourselves at home and out of the community. So what do you do when you need to go to the hospital? I would call and talk to your doctor or midwife to let him or her know that you're on the way. If you think that you have a fever, or you have a fever, and you think you might have COVID-19, then I would definitely call ahead of time, because they're going to tell you where to go to get the best care. So this is a communication process, and all doctors and midwives should have an answering service or office phone numbers where you can reach them. When you get to the hospital, at this point in time at Advent Health, we're allowing one support person to come with you to the hospital. That may or may not change, so contact your doctor or midwife, contact the hospital to ask them, but go ahead and bring some stuff to stay with. There should be no changing out of people. Hospitals are trying to limit the number of folks who are walking through the hallways, which I think is a smart idea. So we want also, though, for you to have a supportive and good birth experience. So I will tell you that there is some anxiety some ladies and their loved ones are having about this. I was delivering babies yesterday in the hospital. My partners have been delivering babies every day. There's babies born all over Central Florida. And honestly, ladies are doing great with this, all right? Babies are going to come when they want to come, and moms are going to deliver them. So it's been happening for thousands of years, and I admire the fact that people are so strong in the face of this pandemic. We're going to get through this. It's going to take a little time. And so let me show you some resources you can use to help you and your family. So I'm going to swipe over here. So this is super easy to do. You just type in whatever search engine you use, CDC COVID-19 pregnancy, and here's the website. I'm going to give you these resources in just a minute. Advent Health has a ton of resources. Just got off the phone with our patient experience coordinator, a lovely lady who does a fantastic job, and her team. This is the Baby Place Academy app that you can just go down here and register for. And that's something you can use on your phones or your iPads. The Mom to Be consult is how to get a consultation now that you're pregnant. And there are lots of classes that are done virtually. The lactation specialists are phenomenal in our system, and they are doing a great job with telemedicine, lactation consulting, and then you can also have a virtual tour. So I'm going to put these up there in case somebody wants to pause their video here and go back in a second. These are the resources you can use. You can also just click on our Advent Health for Women main website, and that landing page will take you to all these different options. We welcome you to do that, and I would actually advise you to do that. So in conclusion, what I'd like to say is, first of all, congratulations. It's a tough time, but again, people are very strong. They're going to do a great job with this. We're here to support you. We're here to help you. Our job is to answer any questions and to be reassuring and to treat you well. So please do not hesitate to use this as a resource. Good luck, everyone, and best wishes.